Well, very good morning, and thanks for joining us on all of our WLOX streaming platforms for this week's Expert Alert. So just kind of an update, to kind of inform you if you've never joined us before, on our Facebook page, we are live right now, and we have it, I have it up here on my screen. If you have any questions that you want to ask the expert, do it right here in the comment section, and we can refer those questions to our expert in real time, and you can get the answers to the questions that you are looking for. For today, on Expert Alert, we have Dr. Sonia Spencer from Spencer Chiropractic. Good morning.
Good morning.
How are you?
I'm wonderful.
So tell us a little bit about yourself and how you got into chiropractic care.
Okay. When I was 19 years old, I started working for a chiropractor, and I applied. I got hired out of over 100 people. Ooh. It was divine providence.
Right.
I ended up working there over 9 years and loving chiropractic and seeing the miracles that it helped people with every day. And so the doctors I worked with encouraged me to go to chiropractic college. I ended up doing that, and I graduated. It's going to be 25 years this month, next week, that I've been a practicing chiropractor.
Wow.
And I still love it today just as much as I ever did.
So there's a lot out there. There's a lot of chiropractic care happening here in the nation, much less here in South Mississippi. And so what makes Spencer Chiropractic stand out among all of those that are out there?
That's a great question. And because I've been in practice for so long, I tend to gravitate toward seniors. And a little story about that: when I was a kid, my mom worked in a nursing home, and I used to go and visit the residents when I was a kid. It was just a different time, and my mom could take me to work with her, and I would comb their hair and talk to them, and they would tell me stories, and I've just always loved seniors. So my practice is mostly seniors, although I do treat people in their 20s and 30s and even have teenagers. But who I love to treat are seniors because I want to help them with their mobility. I want to help them have a quality of life and not just lose everything because they turn 70, because they turn 80. You know, our mobility determines our quality of life at that point in the game. And so I decided to focus on things that would help mobility and help people keep their flexibility and mobility in their legs and feet. And because I saw that was the number one thing that really shut people down, is not being able to walk or go on vacation or shop or spend time with their family or get down on the floor and play with their grandkids. You know, and once you lose those things, it's very hard to get it back. And so that's why I do what I do, and I love it.
I feel like there's a mental health and quality of life aspect to all of this as well, because you mentioned, you know, playing with grandkids or playing with kids, getting down on the floor. I feel a lot older when I get out of bed in the morning than I probably feel like I should. I get chiropractic care. I'm there once a month. The feeling that I have when I leave is like, it's unreal. I didn't do anything with chiropractic care prior. I was in an accident, and everything just kind of like does like this when you're in an accident, and you don't realize that you're having issues until a day or two or a week or two or a month or two later. And then that's when I started really doing this every month, and it has changed just like the range of motion. Mm-hmm. There's a whole quality of life piece. Can you speak to that when it comes to like the chiropractic care that you get, how it just helps you feel better and live a better life?
Sure. So as the joints age, if they're not moving well, they're going to cause the disc to dehydrate and more pressure on nerves, and that leads to loss of mobility or loss of feeling good on a regular basis. So in chiropractic care, what we do is we restore joint motion, freeing up the nerves and allowing the nerve system to work properly, which means you feel better, you move better, and you think better. Like you said, there is a mental health aspect, because when you're not feeling good, and that happens day after day after day, or you're not able to go and shop for your groceries, you're not able to go out with your friends, it starts wearing on you. And a lot of times people do come in, they're very depressed because they've been given medications that are not working.
Or that are causing other problems.
Causing side effects. One of the leading medications I see today causes balance problems and problems with brain function.
Wow.
And they're giving that for pain. So natural pain relief is always better. It's slower. We're a fast society. We want to drive through and have that experience of like we get at the fast food restaurant. And healing is not like that. You have to put your time in with your body. If your body has been deteriorating for a while, It's going to take some time for that body to begin to heal. And one of my main focuses is on neuropathy. So I've been doing neuropathy care now for almost 10 years. I went and I got specialized training in that so I could focus on healing those burning, stinging, numb, tingling feet that are interfering in that good quality sleep, shopping, friends, community, so that these people can thrive in their 70s and 80s instead of staying home and not feeling like doing anything.
Yeah, and I think what I like most about this is that, and this is one of your kind of your key pillars, I guess you could say, you don't do this with injections. You're not cutting into people. These are like not surgical procedures, or it's much easier just putting your hands and making adjustments or using. Tell us a little bit about how you accomplish that without doing anything invasive.
So we have some equipment that helps nerves heal, and it does that by driving oxygen and nutrients back into the nerves. They're causing the nerves to die in your feet due to lack of good nutrients, oxygen, and blood supply down into the lower feet and legs. And so once we restore and start giving those nerves what they need to communicate with your body, if you're not feeling your feet, you're going to have balance problems. Sometimes I see people that drove to my office that can't feel the gas pedal. That's kind of scary.
Yeah.
And if that progresses, which neuropathy is never standing still, it's either getting worse or you're improving it with care. Just like an untreated diabetic, it's a chronic condition. You need ongoing care to help manage those nerves. Once we find out what phase your nerve damage is, we'll be able to tell you, number one, are your nerves still viable, which means can we help your nerves begin to heal? It's rare that we get 100% reversal, but we get some pretty strong reversals in neuropathy. In fact, we just got an email from a patient that completed our neuropathy reversal program, and she did it with the intent of going on international trips. So we got an email from her yesterday, and she was so thrilled to tell us how well she's doing on her trip, traveling to all these different countries with her son, that she would have never been able to do that trip without our care. And that's why I get up in the morning. That's why I do what I do, because I want to help people thrive, not just survive, not just make it through the day, not just make it to medication time, but to thrive and be healthy and enjoy life. Because so many people think as senior citizen, the people tell me all the time, these have not been my golden years. And health is not 100% of what we do. There are some things that are beyond our control, but we do have control over our bodies, what we put into them, and how we can help heal them. And so I want to empower people to get that control back through their diet, through these healing programs that help their nerves heal and help their nerve system function at the highest rate it possibly can.
Yeah, I think I'm glad you mentioned that, because I was going to ask about, because we talked about that individual before we started who's now traveling, and they're able to do that because of this treatment. You don't think of that. You don't think of those, I just think of getting up and walking from the couch to the refrigerator and my feet don't feel good, or I'm walking up and down stairs and there's a pain in my arch. You don't think about the fact that it's stopping you from doing the things you want to do, especially for those individuals who've worked their whole lives and now they're retired and they want to spend this time doing things they couldn't do because they're working 40, 50, 60 hours a week.
That's right. And neuropathy occurs in 4 different stages. In the first stage, you have up to 25% sensory nerve loss. In the second stage, up to 50%. In the third stage, it's up to 75%, and this is where the mobility really comes into play, because once 75% of your sensory nerves have depleted or they're dead down there, you're not going to be walking around without a walker or a wheelchair for too long. And then in the final stage, there's amputations. Now, usually we have that with uncontrolled diabetes or people that just do not take care of themselves, but we do have quite a number of patients that come in stage 4. So if you're just beginning to have symptoms, I encourage you to have the exam and see what stage you're in, so you can know what your prognosis will be and how you can heal your nerves now before you get to those final stages.
Yeah, I'm glad you mentioned that. I was just about to ask, so if someone's watching right now and they are, making sure we don't have any questions, and they are beginning to notice something different, what does that process look like from watching this segment to, getting into the office with you? What does the steps look like for that process?
So all it takes is a phone call, and our scheduler can talk with you and get you on the schedule. And what we do is we schedule you for a nerve exam. And with the nerve exam, we look at your mobility in your lower legs and feet and see what is causing your nerve system not to work properly. So we test the nerves in over 20 different ways. All it takes is a phone call, and most people have had some testing, but no treatment other than the pills, or no treatments other than shots, or no treatments other than physical therapies, which I don't have a problem with any of that, but it doesn't heal nerves.
Sure. So
in neuropathy, your nerves are either healing or they're incurring further damage. They're not standing still.
So what are, in addition to neuropathy, what are some of the other key things that patients will come to? What are some of those top level, ailments that folks are having when they come see you?
So a lot of times people think they have neuropathy, and they don't. They have chronic plantar fasciitis.
Oh.
And so once we are able to make that distinction, that's something that's easier to treat than neuropathy, and we can help them with that. And some people actually have sciatic nerve pain from herniated disc in their back. That usually occurs in one leg. And so I've been in practice 25 years. I have ways to test to see where is the pain coming from, what is driving it. And once we get at the source of that, once we get at the source of where the pain is coming from, we can begin to target it, we can begin to heal it, and then mobility, quality of life improves. I had a patient just start this neuropathy program. She's only been in a few times, but she said, my husband and I were watching WLOX one night, and I saw your commercial on TV, and he just gently nudged me and he said, why don't you try something like that? You've tried everything else. And so she said she called, and when she came in the other day, she reported it was her first pain-free day in a long, long time, which actually shocked me because that she was pain-free already on that day. But what we do really helps people. It really helps the nerves heal. So she reached out and did that phone call, stepped into the unknown. Her husband was with her the entire process. It's always great to have another person come with you. I have a lot of patients bring their kids, the elderly patients bring their kids if their spouse is deceased, to their appointments so they can actually see the examination, see what we're doing, see how a person can't feel when we stick a pin in their foot, that they don't feel it at all.
Wow.
Or when we shock them, they can't feel it. So a person like that is in danger of stepping on glass or nails or stuff and not even knowing. I've had patients who've had ants bite them and eat them up, and they never even knew it. I had a patient that stepped on glass and got blood all over the floor in his house, never even knew his feet were cut. So once you lose a feeling in that feet, it can cause all kinds of problems, not just with mobility, but with danger, with ants, with glass, with going to the beach, and once you can't feel your feet, it's a game changer.
Yeah, I couldn't imagine. Like I said, and it's maybe atypical for patients to have instant relief like that, but it's not atypical for patients to have relief within a couple of days. Like, this is one of those things where you're not treating a symptom, you're treating the root cause, and people are getting results really fast.
But for severe nerve degeneration, it can take up to 18 months for the nerves to heal. So I don't want to set that as a precedent.
Sure.
I'm saying that was highly unusual that
Right.
she felt so good so fast. And those are just cases we all long for, but most cases aren't like that because we're dealing with a lifetime of poor health habits.
Sure.
Neuropathy has over 100 different causes. Neuropathy is just one of them. The more chronic diseases you have, the slower your body's going to heal. Obesity, lack of good nutrients in your body, and a sedentary lifestyle just make things slower. So if I can get a patient up and moving around, their quality of life is going to be better than if they can't walk or move or grocery shop or do community
Sure.
anymore because they're home sitting in their chair.
Absolutely. Listen, if this sounds like you, or it sounds like someone you know, you heard Dr. Spencer say the support system is an important piece of this healing. If this sounds like you see that phone number on your screen, 228-575-8660 or SpencerChiropractic.com. Give them a call. What's it going to hurt? Except for more hurt if you don't call them. Give them a call and they'll be able to get you on the right path. Dr. Spencer, thank you so much.
Thank you.